All right, so I'm going to click admit all. We only have 37 people right now, but more will come. So again, as you see them, just admit them in and mute them. Hello, everyone. Welcome. Welcome to today's event. This is the 8th installment of our Roundtable series, Successful Public Health Approaches in Dementia Caregiving of our Public Health Centers of Excellence on Dementia Caregiving. Let's give everybody just a minute or two to join. Today, we will be hearing from our Georgia team about their work in dementia. While we wait, these are just a few reminders as people join. Some housekeeping reminders to make this easy flow today. We are in a Zoom meeting setting. So just to allow for better participation, which requires us to kind of have some of these rules, please, as you join, mute yourselves, and you can turn your video on as well. And so that we can tell who is in the room, do please put your Zoom name, your name and your organization. I see that people continue to join. Welcome, everybody. We'll be starting in a few seconds. These are just some of our reminders for today, and we will be going over these in a second. Right, so I think we can begin. Again, thank you, everybody. My name is Elma. I am the coordinator of the BOLD Public Health Center of Excellence on Dementia Caregiving. We're thrilled to have you here today. As I was saying earlier, this is the 8th installment of our series, the bi-monthly series, where we feature one state's work in dementia, and with a special focus on dementia caregiving. Today, we will all be hearing from our BOLD team in Georgia. And again, my name, and we always like to start all of our work here at the University of Minnesota with this land acknowledgement, and really remembering and reminding us all that the U of M Twin Cities campus is located on traditional, ancestral, and contemporary lands of Indigenous people. We acknowledge with gratitude and are grateful to the land itself and the people. And we are sure that in today's webinar, you will see and that we reflect and honor these traditional Dakota values, the courage, wisdom, respect, and generosity. Many of you have attended our webinars in the past, and you probably are familiar with the Public Health Center of Excellence on Dementia Caregiving, but for those who are new to this or attending for the first time, we are one of 3 national centers focusing on helping really build a public health infrastructure for dementia, and we focus on dementia caregiving. We are a dissemination center, and we work to support public health departments in their work. And we do that in 3 main ways: by improving access to evidence-based programs, promoting those, facilitating connections between public health and a variety of other collaborators, and also providing tailored assistance and help to states and public health departments in their dementia caregiving programming and initiatives. You can visit our website. If you scan the code, you can see on the screen right now. And our center is a part of a larger collaborative, of a larger group, and which is composed of partners funded by cooperative agreements under the National Healthy Brain Initiative and the Building Our Largest Dementia Infrastructure, BOLD. And we work together to elevate dementia as a public health priority. You can visit our website and really learn a little bit more about each member of our group. Because this is a Zoom meeting, we are not able to put the link when you close the Zoom, the link to our survey at the end. So please, we encourage you to please open this on your phone now and to give us feedback, because we really look at your feedback for ideas for what is meaningful and what you would like our center to work on in the future. Provide ideas for future events and give us feedback on what has gone well and what we could improve upon. Thank you so much in advance for your comments and suggestions. As I mentioned earlier, this is a bi-monthly roundtable series. We try to make it as interactive as we can. And while our primary audience really are public health professionals and agencies, we really welcome everybody to these sessions, as you will see in a poll that I will launch in just a second. We highlight the story of one state at a time, and in each session. And we view this as an opportunity to network, to meet each other. That's why please remember to put your name in your Zoom window, so we know where you're joining us from, what state and what organization. And we are trying with this webinar series to build a community of practice, where agencies come together, share successes, and what have they learned, what hasn't worked, and get ideas for what they can do in their jurisdictions in the future. A few reminders that you saw at the beginning. Again, we're in a Zoom meeting, so please mute yourselves. Feel free to turn the video on. We're in the same room. We're not in the same room physically, but we can be present in that way, hear from one another. And submit your questions for the speakers as they come up in the Q&A feature here in Zoom. Reserve the chat for a conversation space. Drop resources, links, or answer the questions, because you will be asked questions throughout this presentation as well. And again, thank you for giving us feedback at the end of this event. We really, really appreciate it. So we would like to just get an idea of who is in the room. And for that, I'm going to run a brief poll. Let's see if I can start here. All right, you should be seeing the poll on the screen right now. And please select the answer. In what capacity are you attending this event? Public health agency, a bold public health agency, or a non-bold public health agency? Are you a community organization or service provider, perhaps? Caregiver, a person living with dementia or cognitive impairment? Okay, thank you. I see many answers are coming in. I will end the poll in just a second and hopefully share the results with everyone on the screen. All right, I think everybody's answers are in. As you can see, we have the majority, about 26% are community organizations, those key partner community-based organizations and service providers, the key partners of public health agencies when it comes to really reaching and serving caregivers and people living with dementia. We also have just as many public health agencies, half and half, bold and non-bold. And welcome everybody else. All right, thank you. Thank you for taking the second to answer. And next, I would like to introduce our speakers. Again, we're joined by the Georgia Bold team. Today we have Elizabeth Head, who is going to kick us off. She has worked in public health for 17 years. And as Deputy Director for the Injury Prevention Program at the Georgia Department of Public Health, she coordinates the B-Scene project for Georgia, funded by the CDC, which aims to incorporate public health into dementia. Next, we will hear from Lynn Joyner, who is a dementia care specialist in Georgia and works at the Heart of Georgia Altamaha AAA. Prior to being a dementia care specialist, Lynn was the aging planner for 5 years and the aging resource specialist for 10 years. So a long time serving the community, Lynn. And finally, we will hear from Sarah St. Hamilton, who is a lifespan developmental psychologist and assistant professor at the University of Georgia Institute of Gerontology. She serves as a director of social support services for the Cognitive Aging Research and Education Center, which is a clinic that we'll be hearing about today that offers dementia diagnosis, education, and support to the community. And as we feature in Welcome States in this series, we really try to align their work and call everybody's attention to how they really align with the 10 essential public health services. And we have highlighted those that will be more strongly reflected in today's presentation, but I'm sure they will be touching on the others in some way as well. So without further ado, I'm going to hand it off here to Liz.
Good morning, everyone. Liz Head with Georgia Department of Public Health. I would just really like to thank our organizers at the Public Health Center for Excellence at the University of Minnesota. You've been really fantastic partners throughout this whole process. Next slide, please. All right, I would like to start off by giving everyone just a little bit of an idea of the landscape that is Georgia. We are a 159 county decentralized state. 118 of those counties are designated rural and or have populations below 50,000. And as of the Alzheimer's Association facts and figures reports from 2021 and 2022, we only had 100 practicing geriatricians. Our friends at the University of Georgia, who you'll hear from in a little while, helped to put this slide together, and I'm thankful for them for that. Georgia's ranked 50th in healthcare for older persons. There is a 37% increase in ADRD incidents since 2018. We provide hundreds of thousands of hours of care, valued in the billions of dollars. And more than half of Georgia's caregivers have chronic health conditions themselves, 21% of which have depression. We have almost a 400% workforce increase need to meet the demand of ADRD care by 2050. So as you can see here, the need is high, and the work that we face as a state is great. Next slide. Georgia is one of the states that received a BOLD grant. We first received a 3-year enhanced grant. We were successful in receiving the new component 2 5-year grant. And I want to draw your attention for a moment to our letters of support. For our first round of support, we received 23 letters of support. For our second round, we received 62. And the reason I bring this up is because everything we do in Georgia, and I suspect what most folks do on this call, is surrounded in partnership. And providing support, appropriate support, expanding the support available to care partners and their family members that they're providing care for really does rely on that type of partner support. Through everything that we do within public health, as we wind ourselves into the fold of dementia work, we are looking to achieve that public health approach to all areas of our Healthy Brain Initiative. Dementia risk reduction, early detection, of course, caregiving, and educating professionals. Next slide. But really, what do partnerships in Georgia look like? I'm sorry if you're hungry, it's very close to lunch, but really it is very much like a very large plate of pasta. Picture your favorite pasta. It doesn't have to be spaghetti, but I have a 10-year-old, so that's what we eat in our house. We've got a lot of partners, academia, nonprofits, advocates, care partners. Now, where those partners begin and end is a little bit of a jumble. And it's important that we understand what their reach is, what their reach could be, and most importantly, how we can help them extend the reach that they have. This is particularly important in partnership work because as a public health agency, we do a lot of things, but mostly we are a bridge between groups. And so whether we're speaking with physicians or businesses, supporting people that are living with dementia, or we are a state agency like ourselves, the goal is to figure out where our current capacity is, where we're touching each other, and how it is that we can support each other on those overlapping pieces. Next slide. Within Georgia, I wanted to give you all a quick sampling of some of the partnerships that we've started to kind of unravel from that large plate of pasta, if you will. You see here several logos. So we've got our UGA Care Center. They're all throughout rural Georgia, even though they're housed in sort of that northwestern part of the state. They have reached out or will be reaching out all the way down into South Georgia. Our memory assessment clinics, and in Georgia, our legislature saw fit to provide funding so that we could have memory assessment clinics in our state. So our state unit on aging is charged with monitoring the contract with Emory University that does those. So where you see either a blue or a gray circle with stars, that is the current reach and soon to be reach of our memory assessment clinics. And then the additional thing that we have is within the Department of Public Health, we are creating telehealth sites that support currently the Emory Memory Assessment Clinics. We hope that they can also support our friends at UGA and their care support areas, which Sarah St. Hamilton will talk to you a little bit about later. But even within these care structures within organizations, these are largely focused on getting to diagnosis. Our friends at UGA do a lot of work with care partners, with communities to prepare care partners. And then what you don't see on this map are our dementia care specialists, which Lynn Joyner will talk to you about in a little while. So even though Georgia has a lot of really positive things going on, there are some obvious holes that we're working on. This map was up to date as of September of 2023. We've actually already made strides since then to fill in that northwestern gap and that southeastern gap that you're seeing on the map in front of you. Next slide, please. So what is our traditional public health role? If you're within a public health agency, you recognize everything on this slide. Certainly surveillance, monitoring of the data, training on data, working towards prevention, specifically for dementia and Alzheimer's disease, looking at risk reduction. We want to do those education pieces. But really, what we need to be aware of within public health is our own capacity limitations, and that we're not typically direct service providers. Certainly within a local health department, those folks are providing vaccines, they've got women's health patients, they've got maternal and child health patients that they're working with. And within the Georgia Department of Public Health, we hope also to provide care and resources to those populations, as well in the future for the populations that might be at risk, and we could screen to get them into that path to diagnosis. But really, at the state level of public health, when we talk about care partners, the very best thing that we can do is to support the people that are providing those direct services in really important ways. Next slide. So some of the ways in which Georgia Department of Public Health supports care partner programming in Georgia. There is a wonderful organization called Second Wind Dreams. There's a virtual dementia tour that they provide. Many of you may be familiar with that program. My partners on today's discussion will go into more depth about what it is that they do with each of these. But for the virtual dementia tour, we support the training of leaders and facilitators. We support and encourage our partners to always use these virtual dementia tour events, not just for the community, but also for the professionals that serve the community, as well as for students in training, because we're trying to lift all boats. It's uneven, but we are trying to lift all boats in very specific ways. Another program that we support and that our partners at across the state support is Savvy Caregiver, an in-person or online, and then Telesavvy, which would be the virtual version of Savvy Caregiver. So this program is very specifically skill building for care providers, for care partners. How is it that they can take care of themselves and take care of their family member with some type of dementia? So we again support the training of leaders. We provide program resources, the books. At the moment, Georgia Department of Public Health and Emory University hold 2 licenses for Savvy in our state, because that is a program that has to be licensed. And while I can't speak to whether or not we're going to have the ability to do that in perpetuity, we certainly have the ability to do that as in the next 5 to 7 years. And so we'll continue to do that while simultaneously looking at other ways in which our mostly volunteer-led state could continue this valuable program. We piloted this in extension offices, and our memory assessment clinics have subject matter experts and care education providers that provide the telesavvy version. And so we're working with them to do some joint evaluation work to figure out ways that within Georgia's rural settings, we can make this program more robust and viable for our rural states. Another really important program that we support at the state level of the Georgia Department of Public Health is ALTER. ALTER is really a phenomenal group and program. They introduce African American faith-based communities and churches first to being dementia friendly, but really they're working with them to cultivate a great culture of care, right? They support doing risk reduction, talking about chronic disease management. We've connected our friends at ALTER with UGA and the work that they're doing. We've connected them with Second Wind Dreams so that they can also do the virtual dementia tour. That whole piece where it is that we're connecting and expanding the available capacity for such a phenomenal group within our state. We want to always support the expansion of their sites and their program activities. When they started including risk reduction education, both because it made sense for their congregations and because it was a next step, we're working with other partners to provide them with resources that they need to provide that education so that they don't have to try and scramble and find those things. Next slide. So that is what we're doing at the state level here in Georgia. And I very specifically wanted to introduce you to the landscape and have you get a sense of what's happening at the state level. But the real meat of what Georgia is doing around care partners and caregivers in our state is for our next two speakers. Before we move on to Ms. Lynn Joyner, who's going to talk to us about being a dementia care specialist, we'd like to hear from you, the audience. With things that we struggle with in Georgia. Where do you get your local level of caregiver data? Would love to hear from you in the chat, or if someone wants to raise their hand, we can do that. Elma, I didn't know if we wanted to take a moment for this.
Yeah, let's give folks a little bit of time. Feel free to share in the chat. As I mentioned earlier, it's our kind of community conversation space right now. But if you have, as Liz said, if you have something really good idea, innovative approach, something that you would like to share that you're doing, please do raise your hand.
Yeah. And that could be to either of these questions. The second question, as you can see, is how do you overcome turnover of volunteers when you're working to make your evidence-based intervention programming sustainable? That's something we've really struggled with as well.
I wonder if there's anybody here in any states or agencies that can also rely on a volunteer base to deliver programs. You could speak to that. I see answers here.
So we've got local dementia-friendly groups that offer training. So leveraging that group that's become dementia-friendly to also offer trainings, I think is a great idea and one way to do it. I love that. Thank you, Patty.
Oh, and then Julie in Louisiana. Hi, Julie. Some of our stakeholders in Louisiana regionally collect data, as well as the association. Yeah, I mean, there are collaborations on all levels across the states. The public health department is so good to see this.
It is.
Yeah. So please, everyone, some of you might be typing, so feel free to plug in more information here in the chat. We're going to move on to our next speaker. Lynn, right?
Yes.
All right. Thank you, Liz.
Good morning. Thank you, Liz, and thank you to the organizers for the opportunity to share what we're doing in Georgia as dementia care specialist. My name is Lynn Joyner, and I'm with the Heart of Georgia Omaha Regional Commission, Area Agency on Aging. Next slide, please. So the title dementia care specialist is interpreted in different ways in different places. Next slide. So this is what we're going to show of how we got it set up in Georgia. So we're fostering dementia-capable communities in Georgia with the mission of increasing dementia education and awareness, building stronger community partnerships and support care partners to expand their skills and resources so that they can support persons living with dementia. And to achieve that mission, we're using 3 pillars. We're creating a dementia-capable aging network, training, education, awareness, and collaboration, providing training to our AAA staff, providers, and partners, and raising awareness regarding the importance of early detection and screening. And then we're also doing dementia-capable communities through community outreach and partnerships, going out into the communities and providing dementia-specific community education and driving collaboration within the community. And then our third pillar is supporting people living with dementia and their families, providing education and developing regional capacity to support people living with dementia and their families that care for them. And then driving memory screening and increased access to diagnostic education. Next slide, please. So we're building the plane as we fly it. Next slide. This is the state of Georgia and our map of our counties. So we have a state division of aging services, and within the aging services, we have a dementia care specialist team lead. We have 159 counties in Georgia, and we have 12 area agencies on aging. And our area agencies on aging, we are very similar and we're different. We are located down towards the bottom in that sort of reddish brown color. We have 17 counties for our region. So there are 13 dementia care specialists throughout the state of Georgia. Each area agency on aging has 1, and then the Atlanta region has 2. The funding for the position began in July of 2022, but it was January, February, March when dementia care specialists started being hired this year. So most of us at this present time do not have quite a year of experience in this position. And in that time, we've had 3 DCS positions with turnover. And our initial focus was getting our dementia-specific certifications so that we could offer evidence-based, evidence-informed education. And then it's just kind of being rolled out incrementally as we go along. Next slide. So part of our mission is to form partnerships and do outreach. And so my first project that I did was with the Emmanuel County Health Department, because they were the first telehealth site for our region for the Georgia Memory Net. And this is where people, instead of having to drive hours to a memory assessment clinic, can drive to a closer place and be able to do that evaluation electronically through the health department. So we ended up partnering with the health department, also the Emmanuel County Senior Center, and myself. I met with them individually to talk about, the possibility of doing a project together. And then we started meeting virtually to do planning and division of responsibilities for the event. We emailed invitations to, we wanted this to be a county level event to reach the people who were in leadership roles within the county. So we emailed like the county manager, the county department heads, police, sheriff's offices, the mayors, and others, to invite them to the event. And what we did was we had a morning session and an afternoon session. And each session had a Dementia Friends informational session. And then it was followed by an opportunity to go through the virtual dementia tour. So the senior center, created the flyers. They did the mail out or emails out to the county people. They provided the location for the meeting and for the virtual dementia tour space, the snacks and decorations. And our health department staff created a registration form, handled that. They had not been through the Dementia Friends information session, so they attended the first session. And then they also hosted the second Wind Dreams virtual dementia tour. And then for the event, I created a resource list for Emmanuel County from our statewide resource database, did the Dementia Friends information session, and then helped the health department staff with the virtual dementia tour. So we didn't have a lot of numbers, but we still felt like it was a successful event. The people who went through the dementia tour said it was very impactful. And we had the county manager, we had 2 law enforcement officers, the tax commissioner, the probate court judge. There was like 3 staff from a local nursing home and 2 of the senior center volunteers all went through the virtual dementia tour. And then we also had the sheriff present for the Dementia Friends information session. Next slide, please. And just a couple of other ideas or things that we've got planned for outreach and education. Next week, I'll be doing a TIPA Snow positive approach to care, typical aging versus atypical aging workshop. And this grew out of a partnership that was established through a health fair that we both attended. Living Independence for Everyone Life, our Center for Independent Living, and I are partnering to do this presentation, education. And they're providing the space, they're providing the hors d'oeuvres, and they're doing outreach in the county, while I'm doing the flyer, creating the registration form, and then also conducting outreach electronically to my contacts that I have. So that'll be next week. And then on schedule to meet with our Lawrence County health department, who is our most recent telehealth site for the Georgia Memory Net, to start talking about what we might could do together as an event this spring. Next slide, please. And our focus right now, or at least one of our main focuses right now, is to try and get our coalition collaborative established, and the Division of Aging brought in a consultant who's been working with us to learn about coalition building, running meetings and things like that. We had a meeting this week to continue that education. And we've got a target date of March, April of 2024. So I've been sending out emails to people in my contact list, people in our resource database, just letting them know that we're kicking this off. What is going to be a dementia specific coalition, and would you or someone be interested in being part of this coalition? And I've been pleasantly surprised that thus far I've got 23 people who have said yes. And I'm not even through about half my list of asking. But, I've got the Center for Independent Living, I've got a home care provider, I've got several UGA extension office staff, senior centers, health departments, our person who does our money follows the person. I've got a private business one, some caregivers, hospitals, housing authority, just several more, a VA social worker that have already said yes. So I'm happy about that. And with this, I've got about half of my counties covered by at least one person who can represent that county. Next slide. So I also wanted to get some input from my peers, because obviously I'm not doing this by myself. Just and ask them these questions, you know, what are you doing for engagement in your community? So, you know, there's educational presentations talking about the Dementia Care Specialist program and dementia, participating in health fairs, attending coalitions, council meetings that already exist, delivering outreach information to key locations in the counties, conducting virtual dementia tours, posting activities and events on the Area Agency on Aging Facebook page with hopes of getting information out. And then, of course, always the conversations that we're having with our care partners. Next slide. And then, you know, how are we building equity into your approach? The responses were reaching out, you know, to a variety of individuals to offer the programs, doing presentations at 55+ apartment complexes, at senior centers, partnering with local county health departments, providing information to, you know, to people that we're meeting, or contact lists that are growing, putting information out, and then trying to provide education to, you know, as many areas of the county that we can, and just letting people know that the dementia care specialists are knowledgeable about dementia, available to help with questions and concerns, and then, you know, building our coalition to help us get the information out into the counties and the communities. Next slide. So, you know, a question for you all, because I know it's a challenge for us, is, you know, advancing equity. It can be challenging. And just kind of curious, you know, what other ways, you know, has your state increased equitable access for priority populations? And what are you doing to reach those priority populations? And if you'll put your answers in the chat, please.
Thank you, Lynn. Thanks, everybody. I see a lot of comments in the chat and reactions and questions to your presentation and questions for you that we'll cover later.
Okay.
This is great, Lynn. Great overview of the DCS role.
Okay, so we got some mobilizing trusted partners. Not a lot. Press releases, podcasts, resource fairs, other CDC funded grant programs, faith communities, clinics and hospitals. Yeah. Okay, yeah, great.
Faith-based partners.
Okay, so next slide.
Please continue to enter your comments in the chat. We'll be looking. Thank you.
All right, so some challenges that, you know, we're experiencing thus far. One, as we all know, dementia is still a taboo subject, and it's hard getting care partners and the people living with dementia to openly talk about their concerns and about the future. We still have, in my own personal case with my best friend, people do not want anybody to know that, you know, they've got this diagnosis. So it's also a hard time getting into doctors' offices to get information, education in that location. Oftentimes our speaking engagements are limited to 10 to 15 minutes, so it's really hard to elaborate on more than just the very specific things that we're doing. And then health fair, it just seems like the attendees are really not interested, at least from the experiences that we're having, to have a conversation with us about dementia, or even taking written material. And then also having trouble with, you know, getting the interest or return calls about what we're doing. Next slide. So these are the evidence-based, evidence-informed educational programs that we're doing. We got dealing with dementia, which is part of the Rosalind Carter Institute for Caregivers that was established by former First Lady Ms. Rosalind Carter. As part of it grew out of her experience as a child in caregiving, and that's just where she wanted to emphasize caregivers, supporting caregivers, advocating for caregivers, just very involved in that arena. And then we have some doing powerful tools for caregivers. About half of us at least are certified to do be facilitators and trainers for the virtual dementia tours, and then also going around and doing Dementia Friends information sessions. And next slide. And then just some extra things that people mentioned that they're doing. There's one dementia care specialist who is doing Dementia Jeopardy, which she says people just love. Those are the categories that she has on her Dementia Jeopardy game. Doing just presentations about dementia equals brain change. We also got trained with Leslie Fuller's Inspired Dementia Care curriculum. She has a business where she consults and does healthcare setting trainings, but this is like a 12-month curriculum that has like scripted educational classes. There's like a poster, a big poster for each of the segments. And then she also has created these conversation cards where you can present some information and then ask questions to get participation and engagement in that subject with the people that you're training. And then we've got a number of dementia care specialists who are certified independent trainers or certified independent consultants. And next slide. So in thinking about evidence-based programs in caregiving that's available in your state, what barriers and facilitators have there been for implementing these programs?
Thank you, Lynn. That was great. A great overview of the DCS role. We're getting some responses here about implementation of EBIs, evidence-based interventions,
Yeah,
cost of training,
yeah.
staff training.
And that's one of the challenges we've seen is, caregivers being able to get away to go to training. So we're looking at a pivot to try to work out virtual training so that transportation and getting away from home is not a problem.
Cultural barriers, accepting help from rural audiences. Yeah, staffing, workforce related issues, and workforce capacity seems to be like a major issue. We're seeing a lot of turnover in employees since COVID. Christy Russell mentioned.
And transportation was mentioned. That's a big issue in our area as well.
Yeah, especially in states with a large overall population and families living in rural areas that are harder to reach, especially for in-person activities. Well, keep sharing, please, in the chat again. We really appreciate all of your insight. We will share the chat content, what was shared, and I'll make sure we plug in the questions so you can know in what context these responses were provided. We
Okay,
will share them as materials after today's event, so you will all have these ideas that people shared.
great. Thank you.
Would you share advance, Lynn?
Yes.
Okay. Next, we're off to our UGA Care Center team. Sarah?
Hello, good morning, almost afternoon, depending on where you are, everyone. And thank you again to the organizers for putting together this really wonderful mechanism for us to learn from one another. My name is Sarah St. Hamilton, and I'm the Director of Social Support Services for the Care Center, which stands for Cognitive Aging Research and Education. And we are housed in the College of Public Health at the University of Georgia. And the Care Center's mission is to improve access to education, diagnosis, and support for persons with dementia, as well as those who care for them. My colleagues, Dr. Janae Beer and Dr. Lisa Renzi-Hammond, Dr. Beer is on the call today. They founded the Care Center several years ago in honor of their late grandmothers, both of whom lived with dementia caused by Alzheimer's disease. And I'm really honored to be a part of this initiative and be able to share some of the work that we've been doing in Georgia, you know, specifically related to programming and services we provide to caregivers. But the Care Center truly is a labor of love for all of us. If you walk through our building, you'll be very hard pressed to find anyone that doesn't have a personal connection to dementia. And I think that passion and personal connection is one of the things that helps us to really dream big, but also bring unique insight into what kind of support is needed in real world settings. Next slide. So like I said, the Care Center's mission, broadly speaking, is to pave a new pathway to living with dementias, because we know that people live on average 8 to 10 years with a diagnosis, such as Alzheimer's disease. And we want to do everything we can to empower the person with the diagnosis and their caregivers to make those years as good as they can be. And we do this in pretty much any realm, with just about any audience you can think of. But today, I'm going to focus on our efforts related to caregivers of folks with dementia. Next slide. Before I dive into that, I just want to point out one of the things that makes CARE unique is the fact that we are a truly interdisciplinary team. We follow a integrated model of care. And so this slide gives you a sampling of just some of the skill sets and areas of expertise that CARE represents, but it is not even close to complete. These are just the team leads at UGA that I work with the most when it comes to managing clinical operations and providing support programming, but there's many other CARE affiliates at UGA that aren't on the slide. I think we're partnered with something like 13 other departments across UGA. It doesn't even start to cover the community partnerships we've built. Cooperative Extension and Archway Partnership are, you know, huge entities that we've partnered with. And it doesn't really capture the interdisciplinary students that receive training here at CARE and without whom we quite literally could not function. So as I'm talking about our programming today, just keep in mind that it truly does take a village to make a meaningful impact here. Next slide. So as I mentioned before, Care Center's mission is to provide high quality and accessible education, diagnosis, and support services, especially to those with limited resources, such as in Georgia's rural areas, which, as Liz spoke to earlier on, is the majority of the state's footprint. And so I figured it would make sense to talk about the social support services that we provide using a similar framework. So to start off, I'll tell you a bit about the general education that we provide as it relates to caregiving for someone with dementia. Next slide. We have an entire Care Aware curriculum that our team has developed, and the AWARE piece stands for Awareness and Resilience Through Education. And in true public health fashion, our curriculum covers topics like prevention and brain health behaviors to reduce, risk of developing dementia, knowing signs so that if you do have symptoms, you can recognize them and get diagnosed early, how to get diagnosis, and so on. But in terms of caregiver support, we provide educational seminars in the community focused on caregiver self-care, and both tips on, accomplishing that, and practical strategies, and why it's important. And I give a talk that helps caregivers better understand why dementia-related behaviors happen and gives them strategies to prevent and address them, with the goal of reducing their caregiver burden and reducing experiences of confusion and frustration for the person with the diagnosis. Next slide. Through our collaboration with DPH, the Care Center staff have also been trained in facilitating virtual dementia tours, which you heard Lynn and Liz talk about earlier. And so far, all Care Center students, staff, and faculty have been through the virtual dementia tour experience that the woman sitting in the chair in that image is actually one of my Master of Social Work practicum students who works in the care center, and she's going through the dementia virtual dementia tour in that image. We've trained UGA extension agents, trained first responders, police, fire, EMT in McDuffie County in Georgia. We've trained second year College of Pharmacy graduate students, and we have future plans to extend our virtual dementia tour programming into more of our rural areas. Next slide. And finally, I was lucky enough to be trained to facilitate Savvy Caregiver workshops this past year, and I try to offer 1 or 2 in-person series each year. If a in-person series is not happening soon enough, and we find that there's a caregiver who really could benefit from that programming, we do also have the option of referring them to any of the various telesavvy series that are going on at any given time. So I hold these 1 or 2 in-person series in order to kind of supplement that. But one of the things that I wanted to point out that was discussed, Lynn brought up barriers to accessing support for caregivers. And so one of the kind of intentional decisions that we made when deciding where to host and where to hold the Savvy Caregiver training that I did last summer was that we partnered with our local Athens Community Council on Aging. And they were kind enough to let us hold the series in one of their conference rooms. And the reason we did that is because they have an adult day health program there. And that tends to help reduce barriers, obviously, for caregivers to attend, but it was also done because I've often seen in the support groups that I lead and things like that caregivers are hesitant to bring their person to an adult day health center. And so this was a way to kind of allow them to get their feet wet, to like test out that experience in a relatively low stakes, it's only a 2-hour time block kind of setting, but it sometimes got them over that hump of needing to do all the paperwork to get established to be able to go, and then it would be a resource and be available for them going forward. Next slide. In terms of our diagnostic process, support was intentionally built in at every step of the process. Next slide. We've got, as I mentioned, my Masters of Social Work students do their concentration practicum experience with me in the care center. And so they spend about, each of them spend 20 hours a week in the care center, doing case management, social support consults, things like that. And so they are the first person usually that you talk to if you call the care center. So they're the first person that caregivers talk with. They do a phone screening to see if the person is a good fit for our clinic, is, within our realm of expertise. And then even as they're going through diagnosis with us, when they're meeting with our geriatrician for their medical appointment, we have built in a 30-minute social support consultation where they meet with myself and whichever intern was assigned to their case for case management, to just assess whether there are any immediate needs for support or education or resources, things like that. And I will also point out that our geriatrician, one of the really unique things about the care center is that our geriatrician is a faculty member. And so he is able to provide very extensive educational, in-depth sessions, appointments with our caregivers and the person who's looking at getting a diagnosis. So he might meet with them for an hour and a half, and then 30-minute appointment with me. So I think when people come to us, they really feel like they're getting all of their questions answered, and we're lucky enough to be able to really take the time to engage with them. And then the person looking at getting a diagnosis might get, some imaging lab work done. They might go through neuropsych testing with our neuropsychologist and his team of clinical psychology students. And then at the end of the process, there's a kind of a full team summary appointment where the family, the person, the patient, the family, and any clinician or support staff who worked on that person's case throughout the whole process, we all meet together so that we can answer questions and provide further and more tailored resources. Next slide. Some of the resources that we provide are here. This is a small amount of them. We have resource guides that are tailored to the particular counties that we're partnered with. We also have just kind of general Georgia statewide resource guides. We have information on nutrition, safety, self-advocacy in healthcare, all sorts of things like that. And all of these kind of handouts and pamphlets go into a folder that patients and their care partners get when they receive a diagnosis. And I want to point out that we try very hard not to reinvent the wheel. So we do lean on our partnerships with other organizations and include a lot of materials from the Division of Aging Services, from the Alzheimer's Association, from all of these partners that we have who have really excellent materials. Next slide. Next slide. And one of the most asked for and most used materials is our care partner guide. They are roughly 92 pages, and they are checklists of things that caregivers should be thinking about and planning for. And it's meant to guide them through the unknown territory that is being a first-time caregiver for someone with dementia. Next slide. So there's kind of 3 stages. There's kind of, before diagnosis, during the diagnostic process, and then post-diagnosis. And we do continue to provide support post-diagnosis, whether you got a diagnosis with us or not. And the ways that we do that, the programming that we have are a twice per month caregiver support group. I facilitate that with the help of a community partner from who used to facilitate the support group at the Athens Community Council on Aging. She's been incredibly helpful to me in facilitating this new group. And I try to make the group educational by inviting guest speakers from various partners throughout the state to talk about anything and everything related to caregiving and or dementia, so that participants, caregivers can get their questions answered. And one piece, I see some music therapy questions coming up, but one piece that again, we were pretty intentional about is that we do hold the music therapy sessions that we do. It's a group music therapy session. We hold that on the same day and at the same time as the caregiver support group. So that's a way that we try to reduce barriers for caregivers to attend and increase the number of positive activities that folks with a diagnosis can engage in. And I have to thank our amazing partner, Jenny Stull, who is from the School of Music. And she, we actually worked together so that she could set up the care center as a practicum site for her music therapy students. And then we always have social support consultations and referrals available going forward. So like I said, it's just really an emphasis on the fact that the need for support around caregiving does not go away once you're handed some materials, because as we know, with the nature of a neurodegenerative disease, things change over time. And so people need different types of support at different parts of the illness. So next slide. One final piece, and then I'll kind of wrap up here. Due to the fact that we're in an academic setting, and especially a College of Public Health, we find that our students are really driven to apply what they're learning in class in incredibly creative ways. So I'll share this as an example. One of our MPH students partnered with the UGA State Botanical Gardens to develop an education and support program called Meet Me at the Garden. And the goal of this program was to engage caregivers and their loved ones in a multisensory activity where they could learn something new together, and where the caregiver and their loved one could be on more or less equal footing. We had a ton of care students and support staff in place to help the caregiver set down their caregiving role a little bit so that they could just interact one-on-one in that way. And in each session, there would be things available to taste, touch, smell, manipulate, and to take home and look back on and remember. So they learned about the history of coffee and tea, and got to try different types of coffee and make their own tea bags, and learn about chocolate, how and obviously try chocolate, different kinds of chocolate, how eating greens helps your brain. There was a hands-on sensory activity in every session, like picking herbs in the garden to make a homemade salad dressing that they then ate on the greens that they also picked from the garden. So this was done because as Alzheimer's disease and dementia progresses, people living with the disease and their care partner tend to stay home where the environment feels familiar and safe, and have a harder time socializing with others, or can find that to be the case. But programs like this can be really helpful in disrupting that isolation. The caregivers have more opportunities to interact with other caregivers, talk about the challenges, the difficult days, and the person with the diagnosis experiences a meaningful, positive engagement. Last slide. So I think the key takeaways, probably across, I don't know, several of our presentations, but for me at least, was that it's so important that we tackle this with a collaborative mindset. So collaborating with other organizations helps us to maximize resources, prevents redundancy. So for example, we work with Department of Public Health. Land grant universities can be really helpful. They have connections through extension offices, for example, Alzheimer's Association, other departments, colleges, universities. The interdisciplinary nature of dementia and what it means for daily living means that it really does take a village to effectively support caregivers as well as those who have a diagnosis. Secondly, I would say it's incredibly important to respect and build upon existing relationships and infrastructure in communities that you intend to support. So any community that we go into, it is always made clear. We try very hard to make it clear that we're coming in with a very particular set of expertise, but our expertise is not in what exactly that community needs. That's for them to tell us. They're the experts on their community, and to work together to make sure that we are putting a plan in place that addresses the needs that they, as the community members, prioritize. And then finally, as I've said a couple of times, I think it's important to be creative about overcoming barriers that caregivers might face when we're designing programming. So virtual options are fantastic. We definitely rely on that as well. And there are other creative ways. So providing respite for education or support events, having support groups at different times of day to accommodate people who might still be working, maybe adult child care partners, or those who can't meet at night because they can't drive in the dark or things like that. So I think these are kind of the key takeaways that I came away with in putting together this presentation on what we've been doing. All right. I think we have one more slide with our contact information, and I guess it's questions now.
Wow, this is so impressive. Thank you, Sarah. I'm just blown away by how creative your programming is at the care center.
Thank you.
And innumerable partnerships that you've built with the community, and also by training the future workforce, your social workers, and what they're coming up with, and the great work is just really impressive. So thank you everybody in the audience for attending today, for all of your comments and sharing. This has really spurred a lot of conversation. So how about I start from the first speaker from the beginning? We have some questions, and then I know we have several for Lynn and for you, Sarah, as well. Liz, yes, from the Department of Public Health. So there's a lot of activity happening throughout the state. I mean, the map you showed, and then just more detail that Lynn and Sarah provided. There are a lot of great partnerships. How is everyone keeping up with what everybody else is doing, and where things are happening? Where are the gaps?
The short answer to that is we don't. We meet as often as we can. If we hear something, we tell our other partners after we've made it sure it's okay. So if I talk to Lynn Joyner on a given day and she shares something that I don't know, I'm like, hey, is it okay to share that? And then I might email it to our All Things Dementia group, which is a group of folks from UGA and Emory and Alzheimer's Association and a couple of nonprofits that want to be a part of that, and our state unit on aging. And we try to share the resource out there. Literally on the meeting today, as our amazing presenters have been speaking and our attendees have been sharing their own resources, I've got a Teams chat with my team in the background, and we're swapping resources into there. I suspect Janae and I will be on a call later in the next week or two to talk about a couple of the resources. So we share and overshare. And that's the sort of shorter answer on that, because so many things are coming out. So many amazing programs and approaches to existing programs happen that we want to be responsive without being overwhelming to our partners that are doing some things. So every time we get together, we have a little bit of carved out time where we share what's new, what's trending, what's coming out, and we keep doing that in as many ways that work for all of our different partners. It's really about being responsive to the needs of our friends and and everyone we worked with winds up being our friends. I didn't know if maybe Janae or Sarah or Lynn had anything they wanted to add to that.
Yeah, absolutely. I love that you said we share and we overshare. In my head, there's no such thing as overshare. Communication is so crucial, and there's so many ways that we're connecting and sharing resources and ideas, every time we meet. It's hard to keep track of everything. So those spaces for communication are critical. And, Liz, I have to give a shout out to you where you really have spearheaded so much of setting that communication culture and providing spaces for people to share, what's working, but also some harebrained ideas, right? It's just so critical for what we do and keeping creativity going, because this work can be really tiring. Everybody on the call understands that, but get a group of passionate people together and magic happens.
Yeah, we've emailed and said, hey, I know this is due in 2 weeks, but is it crazy if we try to apply? We've and then the group knows one another well enough that we can say, yeah, it's a little crazy this time, friend. And the other thing is that if a group is working in an area, what is the way that we can be complementary? This is such a large sandbox, and a different sandboxes, and we don't want to step on toes. And as long as we lead with those as our kind of overarching goals, then it's just figuring out what works best in a given situation.
What a great role. I mean, Liz, and what you're illustrating for public health is really just mapping out, where are the collaborations, what everyone is doing. There's so much need for that. And I bet in every state, there's a lot of work happening to support people, cognitive decline, dementia, and the caregivers, and just even bringing them all together and learning from one another. Absolutely. Yeah. Any other comments? Before I move to the next question. There were a few questions for you, Lynn, and I see that you answered some of them already in the Q&A. One of them that I would like to just bring back is about the Dementia Care Specialist certification. April Henkel asked, how are DCSs certified? And you mentioned, depending on the evidence-based program, the training we've chosen to offer, we obtain a certification from the organization, right? And is there any additional ongoing certification DCSs have to take in Georgia to continue working in addition to specific programs?
Not that I'm aware of at this time. I know some of the dementia care specialists have gotten the dementia care practitioner certification. But other than that, it's mainly whatever education that we're offering is what we're getting, quote, certified from them to be able to do their program.
Okay. And I think this was also from Jennifer Shore while you were speaking. Do you have people who work directly with a person living with dementia, care consultation type person?
So within our AAA, we do not have a care consultation like with BRI Institute. We did have that at one time, and that person left employment, so that kind of went away. But we do have, we have our toll-free number. Anybody can call in. Whoever answers can assist to whatever it needs, or it can come to me. We also have an options counselor who can do those kinds of phone calls. We have a case management agency. And again, like I say, we're still kind of building this as we go. And then other AAAs are set up differently, depending on their staffing and who gets assigned what duties. But anybody that calls in, we're going to help and assist and provide information, resources, things like that we know about.
And where do you see the DCS professionals in Georgia going with the work in the future? What opportunities are coming up? What do you see?
I think when I think about my DCS team, And I would never would have imagined that you could pull 12, 13 people from different parts of the state and be such a close-knit group of people who love each other, have compassion, support each other, encourage each other. And I think what we have as a team is also what we want to take to our caregivers, to help caregivers have a team of people, a group of people who provide that support, encouragement, to come alongside and help, and then also to have a community that will do that. I was at a Walmart a couple of months ago, and there was a lady, an older adult lady ahead of me, and she was struggling, and she was having difficulty with her card and the, making her payment. And I watched the cashier and how patient she was, how kind she was. And then her compassion when she came around to the other side, stood beside that older adult lady and helped her with that process. I mean, just the compassion and love and kindness there. And I was thinking, that could be my mom. And when I got up there, I just had to tell her how much I appreciated her kindness and her compassion in that moment, helping that lady. And I think as a group and me, what we want to do is to one day see that community coming together around someone living with dementia and their family who are caring, or the people caring for them. And instead of staying on the other side, coming around beside them and supporting them in that moment in just simple ways, but to see that happening everywhere. And I think that's what our goal is to get Georgia to that place where when you hear the word dementia, the first thing that doesn't come to mind is fear or dread, but hope that, there's still life to be had.
So nicely said. Thank you for sharing that. Thank you, Lynn. I am going to, at somebody's request, I'm going to stop sharing the screen, and then this can help us see each other better here. For Sarah, and for Janae, thank you for being here on behalf of the center, the Care Center. There's several questions here for you, and Janae, I count on you to keep track of what has not been answered. But the very first one is, if I can start, what is the reach for care? So what is the reach? And then where do you get your clients? How do you get your clients referred? How do they get to you?
Great question.
Very good questions. Do you want to start with the referral, Sarah, and then I'll talk about reach?
Sure. So our referrals so far have been largely just word of mouth. It has been, we get referrals from primary care physicians who maybe have come to a talk that we did to learn more about dementia education and learned about us that way. We get referrals from the AAA. So they have a specific referral form that they fill out and send to us that gives us all the information that we need to do a screening. We work with the Athens Community Council on Aging with their Dementia Resource Center that they have there. Cooperative extension agents, patients themselves and their care partners, refer their friends when they notice signs or other people. So we've just got a huge network that we get referrals through, and we're up to, I think, close to 230 patients at this point. And in fall of 2021, we were at 40. So it's been about 100 each year.
And it's a part-time clinic.
And it's a part-time clinic, yeah. So, because it's just one geriatrician and one neuropsychologist to do all the testing.
And you do follow up the person who has cognitive decline, dementia, and then you also include the caregiver care. Do you include the caregiver in regular dementia care for the patient? And how is that? What does that look like on the EHR side, I'm just very curious, and the exchange of information with the primary care provider in the medical setting.
Yeah, great question. So in terms of our clinical services, like the diagnostic services, we are fully a diagnostic clinic at this point, just in terms of our bandwidth. Since we are just, you know, there's one of each of us in terms of our clinicians. And so we do tend to send folks back to their primary care for continued follow-up, but we also are more than happy to consult with primary care if they don't have the extensive, expertise or feel incredibly comfortable navigating that with their client. They are more than welcome to contact us and consult with our geriatrician, with our pharmacist, for example, if they have questions. And in terms of sharing information, we are in the process of getting a fully electronic medical record system. We're currently kind of in the dark ages, mainly on, paper records locked up behind, lock and key. But that is our goal, is to get a electronic medical record system in place very shortly. We've been working on it for a while. And so typically the exchange of information has been relatively cumbersome, faxing, that kind of thing. We have a secure share portal that we can use, but aside from that, it could definitely be more streamlined. And so that's something we're working towards.
Janae,
So,
go ahead. You can
to expand a little bit on that, so our growth has been fast, but as Sarah said, we're still working on still some infrastructure like electronic health records. This is in part because we are a research institute, right? And there wasn't initially infrastructure to build this crazy idea we came up with. And so CARE has been largely funded through our indirect funds from grants and research that essentially is our full-time job, right? So, we're working on a sustainability model. We are in the College of Public Health, so we currently do not charge for our diagnosis. And working through, we have lots of thoughts on sustainability and growth, and so just something to keep an eye on in the future. Regarding sending folks back to primary care physicians, one major mission of the Care Center is to help educate primary care physicians on dementia. Actually, February 3rd, just coming up, we're hosting, in collaboration with Piedmont, a large CE/CME event for primary care physicians, social workers, psychologists, pharmacists. I'm missing a few that are accredited, but and we'll be broadcasting that out throughout some of our communities in rural Georgia. Because one thing we keep hearing, especially from rural primary care physicians, is that they feel very ill-equipped to provide the resources needed for persons with dementia, or even know how to navigate some complex cases that that need screening and diagnosis. So that's a big goal of ours. Regarding reach, I'm going to share briefly. This here is our current reach for the Care Center. So you can see that we are dispersed throughout the state. We're graphically, regionally distributed. Our icons are large for a reason. That's because we have strategically chosen counties that tend to serve as healthcare hubs for even surrounding rural counties. Many of our working communities, they were strategically chosen also due to UGA resources. So with UGA being a land grant university, we have an award-winning cooperative extension program, as well as the Archway partnership. And that essentially provides us the way into these rural communities. It's years, hundreds of years of community building and trust that UGA has put into the rural community. So when we have an extension agent or an Archway agent that says, hey, these folks from the Care Center would like to come talk to you, we immediately get a seat at the table. And so that that, you know, kind of gateway keeper into each community has been essential. So that's our reach at the moment, and it's continually growing and changing. And we work collaboratively with each of these communities to identify their needs. Some have said they needed telehealth, for example. Others have said, nope, we just want to start with education. So each community is a little bit different in terms of our involvement, but it's largely community led in terms of the depth and breadth of our involvement.
Wow, it's impressive the network you all have been built together. Yeah.
Thank you.
Is there, Janae, thank you for helping me keep track of all the questions. I saw multiple questions in the chat. Was there anything else for the care center that that I might have missed? I know somebody requested links to materials, some of those tools and checklists you shared on
Yes,
screen
we
earlier,
are
Sarah.
currently building out a website where we would like to make all of these materials available for all. So that website is currently in the wireframe process. We're working with some folks down the way that are able to program such things here at the university. We anticipate that website will be live at the latest May of 2024, and that will be carecenter.com or .uga.edu, excuse me.
Yeah, that's great. Liz, this might be something great for us to share with our bold community and to disseminate more broadly, especially when these are like handy tools, like ready to use. And that's great. And I see Michael has his hand up and has posted a question in the Q&A. Michael, would you like to unmute yourself and speak?
Sure. Thank you so much for allowing me to speak here. I have to say, I'm very impressed to hear that so many of you folks are starting to use the virtual dementia tour, because that's something I've been pushing for many, many years. And I think it's something that's a very valuable tool when it comes to training people. People seem to, I guess, are more compassionate once they go through that training. They're more wanting to learn, which leads me to, I think more training needs to happen in hospitals. And I've been told it can't be done because it's so hard and it's so costly, but we've done such a great job in the last 10 years. And I should say, I live with dementia, and I've always been a visionary in my field, but I've now taken that to this field of dementia. And while it's hard to get hospitals involved, that should not be a reason that we don't fight to try to make that happen. And I think we've done a great job in the last 10 years in creating education and all kind of ways to educate people and caregivers. But the biggest problem we face is we don't know who the people are that are dealing with dementia. As you know, about 50% of the people, we don't even know who they are. So if we could just create a certification program within hospitals that is overseen by JACO or one of these other institutions, a 3-minute test for anybody that's coming into the hospital to determine if they have some sort of cognitive issue. And if they do, then while they're in the hospital, they're going to get more help because they have shown that. They'll have resources available to them when they leave the hospital to ensure that whatever they're told to do, that they will do. And in some cases, people will not even know they have a problem. And that's where this will identify, and I believe this will close the link of what is missing out there to complete what everybody has already been working on for years now and what's missing out there.
Yeah. Thank you, Michael, for such an important issue. And thank you for bringing it up. And then also there's somebody who already responded to your comment, Laura Ellen, in the chat. And I thought maybe we can ask this question, Liz and Sarah and Janae, what the state, Georgia, has been doing, what initiatives have been done, collaborations, or maybe public health is involved or not, to educate healthcare providers, current and future. We've heard a little bit about the community health workers and just through the center's work, but what else is happening?
As part of our first Bold grant, DPH did, in partnership with the State Union on Aging, we did an environmental scan of what exists around emergency preparedness plans and language, both in Georgia and in other states. It doesn't get exactly to what Michael's saying, and I do not want to take away from what Michael has said, but when we think about folks in egress because of a natural disaster, setting up emergency shelters in those types of situations, we've really got to be able to speak to the populations that are coming in that have a different set of needs. And that exists somewhat, but not really. So we've started with an environmental scan just to see what's out there, so we don't have to reinvent the wheel. And we're currently speaking with our emergency preparedness folks to, try to put language in there and get those types of workflows happening. Certainly in any type of emergency situation, our emergency operations center and other groups reach out to all sorts of subject matter experts, including our State Union on Aging and our AAAs across our state. So, well connected there in terms of communication, but also getting those things down on paper and into policy. Small P policy is something that we're working on actively. We also know that we have several nursing groups in Georgia, outside of DPH, that are doing and working on training for other nurses in all sorts of settings, so that they may have a little bit better of an idea of what it means to work with a patient and their care partners when this set of diseases is involved and what their needs are.
Thank you, Liz. And I see that my colleague Alexandra Nordijk here is here today and from the Bold Public Health Center of Excellence on early detection. There are 3 public health centers of excellence nationally. Ours, which specializes in dementia caregiving, Michael, and then there is one hosted by the Alzheimer's Association, which is the risk reduction prevention, and then the NYU Center on early detection, which works in that space of the clinical space, right? And provided training, bringing in the community to increase, to advance early detection, et cetera. So maybe Alexandra, if you would put a link in the chat to your center's page, that would be great. Like us, their Center of Excellence in Dementia Care, their Center of Excellence works with primary health, but through their work, you can see how help with public health. But through their work, Michael, you can see what public health is doing to try to educate providers about this very issue that you have brought up. And thank you for being here today. And I think we are at time. It's 11:31 here for us in Minnesota. It's lunchtime, past lunchtime for many of you. I'm so thrilled to see that so many people are here. Over half of people really have stayed half hour or longer. I mean, this session was 90 minutes, but thank you all. Thank you to our wonderful speakers for everything you've shared to you today and for the great work you do. It's really amazing what Georgia has built. Kudos. Everything, slides, recording, resources shared will be emailed to everybody within a week. So expect that in your inbox. Thank you.
Thank you all.
Thank you, everyone.
Georgia is rocking it.